doing?
Welcome to Tennessee Fertility Institute's Facebook Live. Good life choices, eating well, sleeping well, getting exercise. But I think the implication of being overweight and the obesity epidemic over the last 20 years, we're really starting to see that impact on live birth rates and just pregnancy outcomes in general. This is a very sensitive topic, and I'm certainly aware of that, as even in my own life, I've struggled with weight and challenges. And one of my doctor friends back in the day said I was gaining baby weight when my wife was pregnant with our first son. So it's certainly, I have some personal history with this as well. So it's not a topic that anybody really likes to talk about, but I think talking about it more empowers people and really gets the word out of things that we can actively do to make our chances of being healthier better, and also not just getting pregnant, but having a healthy pregnancy, and most importantly, a healthy baby at the end of the process. Over the last 20 years, obesity has really just gone rampant in the United States. 2/3 of all Americans now are either classified as being overweight or obese, and that's been a huge increase over the last 20 years. In adolescence, if you look at rates of adolescent obesity, 20 years ago, about 9% of adolescents were considered obese. That number is now 21%. So 1 out of every 5 adolescents is now considered to be obese. Obesity has lots of different implications on body functions, and the most common one is insulin resistance and also inflammation. So insulin resistance is where insulin, our hormone secreted by the pancreas, helps get sugar digested from carbohydrates into our cells to use for fuel. That's the role of insulin. So people who are resistant to that insulin, or who have insulin resistance, their insulin doesn't work as well as it normally should. So the pancreas then makes more insulin, and that then drives the whole process of trying to get that sugar into the cells to use for fuel. We see insulin resistance a lot in the larger major muscle groups in our body. And as insulin resistance grows worse and as higher sugar levels grow worse, it's this just repetitive cycle of higher and higher blood sugar levels. The worst kind of insulin resistance that we know about is type 2 diabetes, and that's where no matter how much insulin your body produces, it can't function very well, and blood sugar levels continue to climb. Insulin plays a huge role in reproduction. It has a big role in terms of how well ovaries function, and it also has a big role in how testes function for sperm production. So this isn't just something that affects women, this also affects men as well, and I'll talk a little bit about that tonight. As insulin increases and as insulin resistance increases, inflammation inside the body also starts to increase. So think of inflammation as if you sprained your ankle. The tissue gets hot, it gets swollen. Inflammation can happen throughout our bodies. It's easy not to think about it because we don't feel inflammation happening. But we know that people who are overweight or obese have more systemic inflammation, or more inflammation throughout their body, than people who are of normal weight. And that inflammation in the long term can lead to heart disease, increased risk of heart attack, stroke, but also in the short term, decreases in a person's fertility potential. We know from lots of studies looking at women who are pregnant and look at their pregnancy outcomes that women who are overweight or obese also have higher rates of miscarriage, higher rates of fetal stillbirth, as well as infant mortality. All of those rates go up. Interestingly, small for gestational age, the baby may not get as much blood flow as it needs to in the uterus. And we also know that preterm delivery rates also substantially increase the heavier that women are when they deliver. A recent study out of the United Kingdom showed that 35% of cases of maternal death were associated with obesity. So 35% of women who died within 1 year of either giving birth or in the childbirth process had some factor that was associated with their obesity that complicated their care and ultimately had a role in their death. So it can really impact a woman's health as she not only tries to get pregnant, but also with delivery itself. When you think of fertility outcomes, it is pretty striking how different changes in obesity can affect a woman's fertility potential. In Europe, quite a few studies were done before we really took this mantle up in the United States. And one in particular has struck me, and it's one that I often reference when I visit with patients. We use different ways to measure body height, weight, But one of the standard forms that we can categorize people is something called the body mass index, or BMI. There are lots of easy to find BMI calculators online. You can just Google BMI calculator. The one from the National Institutes of Health is kind of the easiest one that I've used. So you can enter your height and your weight, and it'll give you a number. It'll give you your BMI. A normal body mass index is between 20 and 25. Women who are underweight, or men who are underweight, have a BMI of less than 20. Overweight is described and defined as a BMI of 25 to 30, and then you get into 3 different classes of obesity. From 30 to 35 is class 1 obesity, 35 to 40 is class 2 obesity, and then class 3 obesity, or morbid obesity, is anything 40 or over. And so one study in particular looked at what's really the impact of body weight on outcomes in terms of pregnancy, but also live birth rates. Who gets pregnant and who doesn't? And they found that there was this bell curve that really, where the majority of healthy pregnancies landed, and that was between a BMI of 20 and 30. But after 30, they did start to see a pretty steady decline in women getting pregnant, but also live birth rates. And they calculated it using statistical models and found that for every 1 point that a BMI increased over 30, that a woman's fertility declined by 3 percentage points compared to other women her age. So if your BMI was 35, 5 times 3 is 15, and so 15 times 3, that gives you more of an indication of how much your fertility may start to go down compared to women who don't have an elevated BMI. So for every 1 point above 30, a woman's fertility declines by about 3 percentage points. Once you get to a BMI of about 40 and higher, that's when we really do start to see some pretty dramatic changes. For instance, if you look at IVF, which is our most aggressive form of fertility therapy, a woman's chance of having a baby after a cycle of IVF, if her BMI is 40 or higher, is 45 to 50% less than it is for women if their BMI is 30 or less. For women in class 2 obesity range, so 35 to 40, their chance of having a baby through IVF is about 25% less. So it really does start to make an impact, and you can see those changes as the BMI gets higher. But one thing I always encourage my patients to do is to look at their BMI and calculate, well, how much weight do I need to lose to try to get more in the normal range? And it doesn't take a lot to make the BMI go in the other direction, to drop the BMI. Most studies will suggest that if you lose 5 to 10% of your body weight, that is a huge improvement in terms of how well women ovulate, as well as menstrual cycle regularity if you have regular cycles or irregular cycles. And that by just 5 to 10% of body weight makes a huge, and can make a dramatic impact overall on a woman's overall success. Now for men, we also know that men who are overweight also have problems with their fertility. Fatty tissue that we call adipose tissue, can make estrogen from testosterone. And this happens in both women and men. Well, men naturally produce testosterone, but the more fatty tissue that they have, the more adipose tissue that they have, the more estrogen that their body makes. And that has been shown in several studies to decrease overall sperm count. It doesn't seem to really impact the overall shape of the sperm or how well those sperms swim, but with increasing obesity, we do start to see lower overall sperm counts. So weight loss can be very important for men as well. If you go to the extremes and you think about what's really the most dramatic thing that a person can do for weight loss, it's bariatric surgery. And so then something interesting does come up, that with bariatric surgery, studies looked at men and their overall sperm counts, and they interestingly found that even after bariatric surgery and weight loss of 50 to 100 pounds, that sperm counts didn't really improve that much. So that may make one wonder, well, is it really being overweight, or is it something else going on inside the body that it's causing these problems? And some more recent studies from this year are really looking at that inflammation piece that I talked about earlier, that even though if men can lose a significant amount of weight, or even if women can lose a significant amount of weight, the inflammation, the insulin resistance that's just coded in their own genetics is still present. So it may not be weight loss per se, it may be more of the lifestyles that we lead. So we've all known that it's important to exercise, it's important to eat well and get good sleep. But one recent study in particular that came out this year looked at overweight women and their ability to get pregnant or have miscarriages. And they found that women who were sedentary, if they didn't exercise, if they were kind of couch potatoes, they had lower overall live births compared to women that they then instructed to exercise and who really started incorporating exercise into their daily life. We know that exercise decreases inflammation. Exercise produces something called oxygen free radicals, and these can eat up the different aspects of inflammation in a person's body. Oxygen-free radicals can cause inflammation, but exercise reduces oxidative stress. So it's that stress from this inflammation that causes havoc, wreaks havoc on the body. And by exercising, we have shown in some studies that that actually helps improve live birth rates. So when they looked at these two groups of women, those who didn't exercise very much, who were overweight, but those who were still overweight and who exercised regularly, they had a 3 times higher chance of getting pregnant than women who didn't exercise. And their chance of having a pregnancy loss was about 2 times lower than those women who didn't exercise. So I really do think that even though it's challenging to lose weight, and weight loss is more of a gradual and progressive thing over time, by getting off the couch, by being more active, and by getting regular exercise, we can really see some important changes and improvements in a woman's overall health. Some patients that I see would tell me, well, my doctor told me to lose 50 pounds before we would start any kind of fertility therapy. I sometimes too give the same recommendation if a woman is morbidly obese, if her BMI is 45 or higher, just because we know that the chance of fertility therapy working is going to be much lower, and her chance of having really significant complications during childbirth are much higher. For example, consider that if a woman's BMI is 35 or higher, 50% or more of those women end up having a C-section for delivery. That then increases their risk of blood loss as well as wound infection. So certainly there are women who need to lose weight, who should lose weight before pregnancy. But it's not just a matter of weight loss in terms of optimizing egg health or uterine health. It is about that inflammation and reducing that oxidative stress that's so important. At the end of the day, we know the things that we're supposed to do. But I also see people go to the other extreme to say, I'm on this fad diet, I'm either doing paleo or I'm on this, there's this new 30-day protein diet where people can lose a lot of weight pretty quickly. But I think you really need to be careful about what we're putting into our bodies too. High protein diets in animal studies have been found to actually lower animal fertility. Protein, as it's digested in the body, is turned into ammonia, and that ammonia can be damaging to reproductive tissue. So in these animal studies, mice fed high protein diets had lower fertility compared to animals who weren't fed high protein diets. So I think it's really important to be cognizant and aware of what you're eating, that just by increasing protein content and dropping carbohydrates really isn't the smartest thing to do. Our bodies need carbohydrates, but we need good carbohydrates. We need most of our carbohydrates to come from green leafy vegetables, root vegetables, rather than starches or complex carbohydrates. I also don't think it really matters if you eat 100% whole wheat grain bread versus sweetheart white bread. The minute that you eat that, it's converted into sugar in your body. And the glycemic index, the amount of sugar that's in food, is really the same in whole wheat bread as is with white bread. So in order to decrease overall, we don't want people to decrease their carbohydrate intake. We want them to eat better carbohydrates. So if you think about when you go to the grocery store, people often ask me, what are some simple things that I can think of when I go shopping, or what are some things I can do to change my life choices? I always start with where we get our food. If you think of how a grocery store is outlined, think of where all the great stuff is, or all the good, helpful stuff is. It's around the perimeter of the grocery store. So you have your produce section, then you have your dairy, proteins. It's all the carbohydrates and all the processed food that are in the aisles of the supermarket. I've often heard too from personal trainers that if you can't read the labels on the back of a food box, you probably shouldn't be putting it into your body. So eating more simple foods that aren't processed, are really helpful in terms of getting healthier carbohydrates and helping with weight loss and decreasing that inflammation. People often ask me too about exercise, and in talking with my colleagues who work in personal training, we know that about 90% of weight loss is diet, 10% is exercise. So people who go to the gym 24/7, 6 days a week, the body actually kind of adapts to what you're doing. So if you're not switching it up, if you're not doing interval training or metabolic resistance training, body weight exercises, it makes it much more difficult to lose weight. If you do the same thing repetitively over and over again, the body adjusts to that. So if you're just hitting the elliptical 3 times a week and you're not challenging yourself, your body's going to adapt and you're going to stop losing weight. But remember that diet is really the most important factor, not just for weight loss, but also for your reproductive health. And that's when it's really important to focus on It's not just about a positive pregnancy test. It's about a healthy pregnancy. We want to make sure that those babies do well throughout gestation, but then moms and babies both do well at time of delivery. Oftentimes, I think it gets lost in the mix that we all focus on having that positive pregnancy test. And that's natural, that's normal, especially when you've been trying for month after month, or if you're doing fertility therapy. That's the one goal. We want to see that positive pregnancy test. But I think what's more important is to take a step back and think about what we're really trying to do. We're trying to build healthy, strong families. So we're talking about healthy pregnancy and having a healthy delivery. We're talking about having a healthy 2-year-old and a healthy 4-year-old who's going to be precocious and start writing on your walls with crayon, who's then going to become a 16-year-old who might crash his dad's truck one day, who then may go on to have a family of his or her own. So these are lifetimes that we're talking about. And I think, and I hope and encourage my patients that even though it may take some short-term gains and some short-term losses in terms of that struggle with weight and fertility, that gains that we see now, whether it takes 2, 4, 8, 10 months, in the short term, that can be challenging. But in the long term, we see so much better outcomes, much healthier, happier babies. And that's what we're all really interested in here. As always, we're available for consultations. I know that there are lots of questions about the sensitive topic, but it really is, kind of boils down to what you do in and day out choice with your life. There's a really excellent website that I want all of you to check out if you're interested. It's called lifechoicesinfertility.com. Dr. David Meldrum out of California is a really well-known reproductive endocrinologist, and he and his colleagues put this website together that really crunches a lot of this data. But more importantly, they give a lot of good information about supplements, about the role of weight loss, and other bad things that we do to our bodies, like the role of smoking or tobacco and alcohol. So definitely check that website out, Life Choices in Fertility, and you may get some good ideas from that website. So to conclude tonight, we know that this is a sensitive topic, but it's spring, it's time to get outside, it's time to walk more, it's time to get off that couch, it's time to become more active. So it may not necessarily be all about the number of pounds that you lose. It may not be about seeing changes on the numbers on the scale. It's about becoming active. It's about becoming active for you, but more importantly for your baby and your family. And I often tell people to think if you're getting down one day, once that day is done, it's done. Every new day is a new opportunity to pick yourself up and try it again. And I also encourage my patients to think if you have a bulletin board in your home gym, or if you're looking at your phone wondering, what am I going to do tonight? Should I exercise or should I watch another Netflix episode? Think of a picture of that baby that you're hoping for, or that baby that we hope that you'll one day have, and use that as motivation. That picture will get you up off the couch, will help you achieve those dreams. And as always, we're here in any capacity to help anybody who needs it, to give advice, to help support and encouragement. We've been seeing some really great changes and things happening here at TFI that we're all excited about. We're also in April, because it is Infertility Awareness Month, we're offering fertility screening for a really reduced price. An AMH level, which checks out kind of the number of eggs in the ovary. It's a simple blood test for women, and a semen analysis bundled together for the male partner and the female partner. This month, we have a promotion where you can get that testing for $100. Now, we do encourage and recommend that you make a follow-up consult visit with me to go over those numbers, to really try to interpret them as best we can. It's certainly not a requirement, but it is something that's strongly encouraged, because we really want you to get the best takeaway and the best evaluation of the numbers that you do have. If you're interested in that testing, give our office a call at 615-721-6250 and tell Chelsea that you're interested in the testing that you heard about tonight, and we can get you hooked up. So with that, I offer you all encouragement. For those of you who are doing it, who are really trying to get at it, good for you. For those who aren't sure about how to get started, I think that talking to your physician is important. I think seeing a nutritionist or a dietitian can be really, really helpful to make that specific plan for you. But today's the day. Seize the day. We're here to help you in any way that we can. And certainly don't hesitate to call us or contact us if you have any questions. With that, we'll open this up now to some questions from Facebook Live. My friend Jenny is here helping me today field some of those questions. So we'll see if anybody out there is listening.
You ready? We've got quite a few that came in through email. What if you have been underweight your entire life and cannot get pregnant or gain weight? What recommendations do you have?
So the question is, what if you're underweight and have had trouble trying to gain weight over time, but just not being successful? A lot of women who may be underweight for a variety of reasons, either a history of an eating disorder or a history of exercising, or maybe their metabolism is just really fast, that over time can have implications on reproductive hormones. Hormones from the brain that talk to the ovaries to tell the ovaries to make eggs. So the first thing I would recommend is making sure that you have just a really good assessment of hormone levels. There are lots of different entities that can cause problems with ovulation. So just having someone who's well trained in interpreting those hormone levels is really important. We look at hormones called FSH, LH, prolactin, estradiol levels, as well as testosterone levels and AMH levels. So I think having a good first assessment with hormone levels is important. Seeing a nutritionist can be also really helpful. Again, I kind of go back to people saying we all kind of know what we need to do to gain weight. So eat healthier fats or eat more calories. But a nutritionist or a dietitian can really take a look at you as an individual and build a specific program just for you. It takes away the generality of these umbrella statements of, oh, just eat more, where you can sit down one-on-one to someone who really cares about you and what you're going through and to make a plan for you, and then who could follow you over time. So even though women may still be underweight, we can use hormone therapy depending on what the actual diagnosis is. So for women who have a history of being underweight for a long time, some of our more standard fertility therapies like pills won't work. We have to resort to more aggressive therapies like injections, but we can do those safely. And I've had several patients over the years who weren't ovulating well, who weren't getting pregnant, who were underweight, where we've had really good success just by tweaking their program around a little bit. But having a good evaluation and also seeing a nutritionist, I think those are really two key important things.
Okay, next question. Does the weight of a male affect his sperm quality?
Does the weight of a male affect his sperm quality? It's really a matter of semantics. We think that the quality may be okay, meaning how well are they swimming? What do they look like? What's their shape? We use the term morphology. But we do know that the number of sperm that a man has will go down the heavier that he is. Those are just kind of general trends that we see. Now, it's not as black and white or cut and dry as it is with some of the data that we have on pregnancy outcomes, because those women are getting pregnant, so we're following what happens with those pregnancies. So we do know that, there's not 100% answer to every question, that we do know that there's some really heavy guys who have no problems with sperm. So we can in general say, absolutely, if a man's overweight, he's going to have lower sperm counts. But we do know it can play a role. And the hard thing with our limited testing with male issues is a semen analysis tells us how many sperm are there, how well they're swimming, what they look like. It doesn't tell us much about function. It doesn't tell us anything about how well those sperm are going to work once they're inside the tubes or once they reach the egg. So that's where kind of the magic of reproductive medicine comes in. But if couples are struggling and if men are overweight, then I definitely think it needs to be paid attention to just as much as cutting smoking or dip or, getting more sleep or cutting back on drinking. Any kind of healthy life choices are important.
Okay, next question. For an IUI, would weight be a factor as well?
So the question is, for an IUI, would weight be a factor as well? So IUI in and of itself is just a way to bypass the cervix of the uterus. So we're trying to get the healthiest sperm that we process in the lab up through the cervix into the uterus. So whether you're overweight or underweight, those issues still apply whether or not you do IUI or not. So yes, if women are overweight, then it will still impact the overall chances of success with an IUI. So for example, we've talked about the inflammation that happens in women who are overweight. That inflammation is what impacts whether or not an embryo can implant inside the uterus. There have also been studies in women who've done IVF with donor eggs. So eggs taken from a woman who may have normal weight, and then those embryos are transferred into women who are overweight, and we still see the decline in implantation rates, increased rates of miscarriage, lower overall birth rates. So that tells us that even though we may have eggs that are considered really healthy from, say, someone who's of normal weight, that it's the maternal environment or the mother's environment that's really the most important thing. So whether or not an IUI is used, the IUI can't improve those factors that we know are going on with that inflammation associated with being obese or being overweight. It may certainly help the sperm get up in the tubes. It may help with fertilization of the egg. Absolutely, that's what IUI is for. But it may not, we don't see huge changes if women are overweight just because of the IUI alone.
Okay. Are there any diets that are not good for someone looking to conceive?
Are there any diets that are not good? Are they seeing this too? They can see the questions? Or just me? Okay, so you can see the questions. All right. I read this paper in preparation for this talk that looked at protein or rich diets that were high in protein. So you think of, 5-10 years ago, it used to be the craze that everybody just cut their carbs, go for high protein diets, and that people would start to lose a lot of weight. The keto diet, is one of those where you really focus on proteins a lot. And based on some of these studies in animals, especially, they found that diets rich or high in protein, higher than normal kind of expected amounts, is detrimental to fertility. That as the body processes amino acids, ammonia is formed, and that can impact reproductive tissue in these animals. And so they found that these mice that were fed high protein diets had lower overall chances of having healthy pups or even pregnancy compared to diets that weren't as high as in protein. So I would encourage people to stay away from high protein diets. I think it really should be, I think the Mediterranean diet is a really good option for people. You get good healthy fats like olive oil and avocado, lots of green leafy vegetables. That's really great for folic acid. A lot of people ask me about MTHFR and folic acid and homocysteine. If you really want to get a lot of good folic acid, eat spinach, kale, good green leafy vegetables. You don't have to get all your minerals from a pill bottle. So good healthy living, good healthy carbohydrates. If you think of just portion sizes, that's also a key to weight loss. Kind of things that you carry around daily give you an idea of what's a normal portion size. So if you look at a dinner plate, one serving of protein is about 4 ounces, or about the size of a deck of cards. It's the size of an old iPhone, like an iPhone 3. That's 4 ounces, not one of the big Galaxy S18s. That's like 2 servings of protein. So if you think of just a boneless chicken breast that you get at the grocery store, that's 2 servings of protein. So you want to cut that in half. So half of a boneless chicken breast is 1 serving. For carbohydrates, a typical serving of carbohydrates is about a half a cup. And one of the things that I help remember myself to eat a half a cup when I'm at Olive Garden, which doesn't often work that well, is make a triangle with your hand like this. That's a half a cup. So when you look at your plate, that's how much rice you want on your plate. That's how much spaghetti you want on your plate. Carbohydrates have so many calories. It's so nutrient rich that you don't need a lot to get the benefit from it. But when I go to Olive Garden, that's my carbohydrate portion. Or when I eat rice or mashed potatoes, we always overdo it, each of us. I think it's really helpful to get measuring cups out at home. When you go to serve yourself some rice or some mashed potatoes, measure out a half cup and you'll be amazed at how small it really is. And then the rest of the plate should be vegetables, whether they're root vegetables or green leafy vegetables. I don't think you need to eat iceberg lettuce, 24/7. That gets really boring. But there are outlets online like Epicurious or Cooking Light. They have really great recipes where you can have lower calorie, really tasty meals. And so that's something that personally I've done to help improve my eating choices, and it's been successful. So that's kind of my rule of thumb. You want to avoid really high protein diets, and you really want to focus more on good, healthy choices.
Okay, and then Katie, can you see that question? Okay.
Do prenatal vitamins play a role in fertility? Any specific supplements in general that women should be taking to support fertility? There are a lot of fads and conflicting information about miracle supplements. Great question. I would direct you back to that Life Choices in Fertility website. It's a question that I get asked at least 3 to 4 times a day. What fertility supplements should I be taking? I have a friend who's on this. I think you have to be careful with supplements for a number of reasons. Number one, if there was one magic bullet that we knew of, one amino acid that helped improve a person's fertility by 30%, everybody would be doing it. And we just don't see that. Number two, fertility supplements, either if you buy them specifically as fertility supplements or just supplements from GNC or the supermarket, they're not regulated by the FDA. So if you buy 1 bottle from GNC in January of, say, CoQ10 or L-arginine or any of the other number of supplements that you might get, the bottle that you might get in March may have different levels of that supplement. So you're never sure if you're getting enough, as much as you think they say that's in there, lower amounts or higher amounts. And that's one thing that the FDA just doesn't control. There are some companies that do a lot more research and development and quality control. And so those are some of the supplements that I recommend. But in general, I think that's another reason why you have to be careful with supplements. We know that people who have changes or different dietary habits do need some supplementation. For example, vegetarians, they don't get a lot of protein, or they may not be getting as much protein as if they were supplementing meat into their diet. So L-arginine is one of the supplements that I've seen that can be important if you have a really low protein diet. Antioxidants, again, I always go back to, I think Mother Nature does it best. If you're looking for antioxidants, blueberries, raspberries, green leafy vegetables, lots of natural foods are really better for us than taking supplements, because they're good for our colon, they're good for our GI tract, they're great for our skin and our bone health and our heart health. We can get so much of what we really need from just good healthy eating compared to supplements. I do think there is some okay data based on some supplements. One is coenzyme Q10. It's really important for the machinery of cells. And so we typically recommend that for women, but I think it can be helpful for men as well. I think any standard prenatal vitamin has what you need. Here in the United States, we eat good balanced diets. It has enough folic acid, it has enough iron, vitamin D, vitamin C, and so you don't go overboard. One has to be careful with prenatal vitamins or extra vitamin supplements, especially with the fatty soluble vitamins like vitamin E, vitamin A. Those vitamins get absorbed into fat and they can build up over time, and you can have much, much higher doses in your body by taking extra supplements of those vitamins, which haven't really been shown to be of much use for fertility anyway. So I do think that some supplements chosen the correct way, chosen wisely, can be helpful. But a lot of times in reproductive medicine, as a lot of you may know, there seems to be this growing fad, and it'll be popular for 6 months to a year, and then it goes by the wayside. And then 5 years later, we'll see it come back up again. If there was one magic bullet, everybody would be on it. And I think sometimes, too, unfortunately, a lot of people put a lot of stress on themselves, wondering, am I taking the right supplements? Is there more that I could be doing? And that, I think, in of itself just causes more stress than causes more problems. So I think supplements do play a role. I think it's just the right supplements. But there aren't any other than the coenzyme Q10, folic acid, vitamin D, vitamin C that I really recommend more than others. Okay, so that's all the questions that we have for tonight. I hope you guys enjoy these little Facebook Live events that we do. We want to make sure that everybody knows that we're here to support you. We're here to encourage you in any way that we can. Don't forget about our promotion this month, Infertility Awareness. Resolve is also doing some great things. If you're not familiar with Resolve, check them out online. It's a great infertility support group here in Nashville. So they do good work as well. But if we can be of any help, don't hesitate to let us know. We'll be planning some other interesting talks in the near future. Probably endometriosis, role of surgery, uterine anomalies. There are lots of different things that we can talk about. But for that, we'll say goodnight, and we'll see you next month.